Here are some plastic surgery trends I won't do. First off, anything that's unnatural. I won't give a patient excessively large implants or fat transfer to the butt that's so out of proportion to the rest of their body. It's just not my style, and it's not something I would like to do, and it's not something that I recommend within my practice. So I would avoid that. Going along with this, I've actually had a lot of patients coming to me for cat eyes, or what's called a cat eye lift. That's when you get sort of an elevated lateral upturn of your eyelid kind of in this direction. To me, that's a little bit unnatural. I don't do that either, and I don't recommend it for my patients. Thirdly, and this should be obvious, is anything unsafe. So let's say I would never even consider injecting fat deep to muscle. It is actually illegal here in the state of Florida to do it, but I'm very careful when it comes to injections in general, whether fillers to the face, fillers to the butt, or fat transfer anywhere. So anything unsafe, stay away from. Fourth is buccal fat pad removal for non-standard reasons. So buccal fat pad removal has historically been done for, the classic chipmunk face, where you have a patient who has excessively full deep fat to their cheeks. In those patients, a buccal fat pad removal can be appropriate in my opinion. However, nowadays you have individuals that are getting buccal fat pad removal to get excessively sculpted and contoured cheeks, especially they want to do it for, let's say, social media or for photography. I stay away from that, and there are a few reasons. It can lead to very premature aging. So you will potentially regret it in the future, 10, 15 years down the road, when your face looks very thin and gaunt. I do a lot of facelifts, fat transfer to the face, a lot of facial rejuvenation, and I like to say that as we get older, a lot of our facial fat is almost like liquid gold. And so you don't want to remove it when you're young. You're going to potentially regret it when you're older. So buccal fat pad removal for non-standard reasons is not part of my practice, and I will not do it. Lastly, a trend that I don't get into and that I won't do is excessive facial fillers or overfilling the face itself. It's not part of my practice. I don't recommend it for a few reasons. It can migrate over time. It creates a lot of scar tissue. It can lead to kind of a heavy appearance in the face, or even if you don't do any more fillers, it almost looks like you have fillers in the area because of all the edema that's built up over time. So those are the trends that are popular, but I won't do, and I don't recommend them either. So if you have any questions or comments, you can either comment below, you can DM me, or follow the link in my profile above.